All right, we're going to quickly go over urology. The first word that you need to know is diuretic. Diuretic is made up of dia and uron. Uron stands for urine, dia stands for through. Diuretic is any medication or chemical that drives water from the body, drives urine from the body. Coffee is a diuretic. You urinate more. Urinary incontinence. Incontinence is involuntary urination with leakage of urine in usually very small amount. Urinary incontinence, there are four types. The fourth one is really easy. It's the mixed incontinence with features of the first three. The first three are stress, urge, and overflow. Stress incontinence, as I showed, is due to internal sphincter problems. Problems within internal sphincter result in loss of very small volumes of urine with daily activities such as coughing, such as laughing, squatting, which all have one thing in common: they increase abdominal, intra-abdominal pressure. Urge incontinence is due to the bladder being overactive, and overflow incontinence is like a full cup. The bladder is full, can no longer, but you don't know that it's full, and so you can't really empty it, and eventually it overflows. Neurogenic bladder is a problem with urinary system where there is a damage to the nervous system that controls the bladder emptying. It can present with any of the types above. And functional incontinence is one of those very sad diagnosis where in patients with diseases such as stroke, patients do have a full control of their bladder, but maybe their motility is defective. Maybe their planning and execution of going to the restroom on time is affected. And so there is an involuntary urination before you reach the restroom. We then talked about kidney diseases that are either chronic or acute. We said that chronic disease is irreversible and you wanna maintain it, but if it does progress to and get worse, the diagnosis would be chronic renal failure. The kidney will no longer work, and the patients will require hemodialysis or, if they're really lucky, kidney transplantation. So how do we measure the kidney function, the levels of kidney function? We measure glomerular filtration rate, which normally is at or above 100. When it's more than 29 but less than 60, we call it a moderate to severe loss of kidney function, and that is the stage 3. Why is it important? Because that's when symptoms appear. So one thing that you do need to always pay attention to is that chronic kidney disease patients do not process protein breakdown products, amino acids, and ammonia, therefore, properly. They cannot. There is a problem with filtration. Their kidney does not work, and so you have to decrease protein in their diet, in the diet of the patients with renal problems and renal failure. All right, let's do acute kidney injury. Acute kidney injury, abbreviated AKI, used to be known as ARF, acute renal failure. We basically group acute kidney injury by location of damage. There is one damage to the kidney itself, there is one damage before that, and one damage after urine has already been made. A pre-renal kidney injury is the damage to the levels of nitrogen in sorry, let me walk it back. Pre-renal kidney injury is due to decreased blood flow to the kidney, which results in decreased filtration of that blood and increase of nitrogen containing compounds in blood, emia, which lead to acute kidney injury. Hypovolemia may be one of the reasons, decreased blood volumes essentially, which can be due to severe dehydration, not just a normal Vegas type dehydration, but severe marathon run in Vegas, maybe one of the reasons. or obviously severe blood loss due to motor vehicle accidents, etc. Anatomical abnormalities such as strictures, less blood reaches the kidney, and heart failure, less blood reaches the kidney because heart doesn't work properly. Renal acute kidney injury would be, there are two terms that you need to know, three terms actually that you need to know, okay? One is acute tubular necrosis. So acute means happening right here, right now. Necrosis is obviously death. And tubular, we're talking about the tubules of the kidney that take urine from glomerulus to the collecting duct. So basically, these tubules have the epithelium, and there is death of these tubular cells, epithelial cells of the tubules, where the cells slough off and block the urinary transit. You do need to know strep throat, and that the same bacteria that cause strep throat can also live on skin and cause problems, itis, inflammation of the kidney glomeruli, kidney glomeruli. And this is because of an autoimmune reaction to the strep throat, to the bacteria streptococci. This results in blood loss, hematuria, that is dark colored, and we call it cola colored. Obviously, with a severe disease like that, you're going to have flank pain and fever as well. Patients are also going to urinate less, kidney is damaged, and therefore there will be an edema, swelling of, first you see it around the eyes, periorbital, but also in the lower and upper extremities if the patient is sedentary, but also the face and potentially generalized. Don't mnemonic to remember decreased. So a mnemonic to remember blood in urine, hematuria is. Let me walk it back. You do need to know the differences between nephritic and nephrotic syndrome. Okay, so nephritic syndrome are have more prominent, more clearly visible levels of blood in urine, hematuria. Okay, nephrotic syndrome, have a lot of protein in them, and so nephrotic syndrome have a lot of protein in urine. Patients with nephrotic syndrome have a lot of protein in urine. When protein is agitated, urine becomes very foamy. We're talking about more than 3.5 grams of protein per day. That patients lose per day. Obviously, you can do urinalysis, analysis of urine as the first step to diagnose nephrotic syndrome. And patients do get better with treatment, occasionally without treatment, but usually with treatment. Corticosteroids comes to mind. And if you see decrease of urinary foaming, decrease of urinary protein, we're thinking recovery. Obstructive uropathy, as the term implies, is due to obstruction. Uropathy is a disease of the urinary tract, pathy of the uro. And here we have a structural block of normal urine flow backing up of urine and uropathy. Now, this backing up may dilate the urinary pelvis and calyces, obviously, and not only does it obstruct the urine, but it also damages the renal cortex and renal parenchyma, resulting in renal failure. Renal failure, that's why the name. But don't forget that this backing up of urine in the pelvis and calyces is called hydronephrosis. Hydro for water, nephro for kidney, osis for chronic condition. What can do this? Kidney stones can do this. BPH can do this. Strictures can do this. Strictures are narrowing. So kidney stones, another term for that is renal calculi. Calculi is a plural for Latin calculus, which means a pebble. BPH stands for benign prostatic hyperplasia. I'll go over it again at the end. And this implies an increase in prostate size which is right outside of the urinary bladder, and therefore a compression of the bladder by pressing on the urethra. It's very common with 90% of males above 80, and half of all the males above 50 being affected. Um, Digital rectal exam is something that can be used to diagnose, to differential diagnose BPH from other problems in males. Digital rectal exam, DRE. All right, so Escherichia coli, E. coli, Escherichia is the guy who discovered them. Coli means they live in the colon. Because they live in the colon, they're very close to the urethra, proximal to urethra. They do live in the colon, therefore they are found in and around the anus. And this is one of the risk factors in females. And that's why females are thought to have UTI more often than males. Itis of the kidney pyelo means the renal pelvis. So renal pelvis inflammation results due to bacteria such as E. coli, for example. Obviously, is going to result in pus in urine, pyuria. So, because there is pyuria, these bacteria. So these bacteria can not only cause pus in urine, but also get into blood, cause chills and fever. Bacteremia is presence of bacteria in blood, and it's called and they cause chills. Okay, so obviously fever is associated, and flank pain is a given. What happens in pyelonephritis is not acute kidney injury usually, but there is a damage around the glomeruli and the blood vessels, the parenchyma, and so it's called the interstitium. And this damage does not usually cause acute kidney injury. Do know about the testicular inflammation, itis of the orchitis, that it's mostly due to bacteria, but rarely due to viruses. Mumps virus, before vaccine was actually made, was regularly used to cause it in thousands, if not hundreds of thousands of infected boys, causing unilateral damage to the testes and decreasing their fertility, but not making them sterile because it was unilateral. Orchiectomy or orchidectomy is the same thing. Ect means ek means out, tomi means to cut, orchi is the testis, so cutting out of the testes, and this is always done when there is a testicular cancer. So once again, benign means good. BPH, benign prostatic hyperplasia, is good. It's non-cancer. It's just a hyperplasia. It's an increase in prostate size with obstruction of the urinary flow where urethra is compressed and a patient has difficulty urinating.